Would you introduce yourselves?
Hi, I'm Andy Brigham. I'm the General Sessions and Juvenile Court Judge in Stewart County. I've been on the bench since 2003.
And I'm Patricia Miller. I'm the Youth Service Officer, and I have worked in juvenile court in Stewart County for 17 years.
Okay, and since today is Drug Endangered Children's Awareness Day, how do your jobs connect you to drug endangered children?
Well, first of all, when a lot of people think about juvenile court, they think about children committing crimes, delinquencies, and so forth. Actually, probably 90 to 95% of our time in juvenile court is spent on what we call dependent and neglected children. Those are children that you might think of as the victims of child abuse. Child abuse takes many forms, one of which is neglect and or physical violence at the hands of the caregivers, whether it be the parents, the stepfathers, you name it. And a lot of that child abuse has been fueled by or motivated by or encouraged by the use by the parents and caregivers of illegal substances or legal substances used to an extreme. And so we are a very small county, 14,000 or less. However, we deal with abused children constantly. We have court only once a week, but for instance, we dealt with a matter today that was extremely urgent involving a child who was probably born positive for cocaine. And we don't know the long-term effects of cocaine on a child, but I would be willing to bet you a hot fudge sundae that those effects are not good. And they won't be tolerated here if we become aware of them. And today's effort was a team effort involving primarily this spark plug sitting next to me, but also adult probation, the Sheriff's Department, and the Department of Children's Services all worked to discover the problem and deal with it. And so far it's been dealt with. But in juvenile court, we deal with substance abuse constantly.
I'll piggyback off of that. We work a lot hand in hand with just parents that need help for getting drug treatment for their own kids, for adults, for juveniles. We see dealing with safe baby court, we do, majority of our cases are due to drugs, or there's an underlying reasoning for stuff that's because of drugs.
Absolutely.
Okay, so you just mentioned Safe Baby Court, but are there other programs that you work with that help deal with the children that are drug endangered?
Yes, we work a lot hand in hand, of course, with Safe Baby Court, with Courtney Wallace, who's our coordinator. We also work locally with youth villages, Camelot, Centerstone, the Department of Children's Services that will help us. They have a program we use with Family Support Services. We've worked a lot with some agency out of Clarksville. We've worked with Allison Boyer, who's done some of our A&D assessments. And we work also with the Child Advocacy Center that will help get us into some programs with kids that have drug exposure or who need counseling due to those drug exposures. And we also work very well with CASA. CASA is a very strong advocate with some of our kids, and sometimes are the only soundboard those kids have.
Right. On the adult side, in General Sessions Court, I have kind of an informal drug court, and we have about 20 adults that are participating in this program, and we work very closely with the Hope Center and with Safe Harbor. Those two, and there are other organizations, but those two primarily because of their proximity to Dover and the fact that they use a lot of grant-funded beds, because if you have to private pay for rehabilitation, it's extremely expensive and well beyond the reach of most Stewart County citizens. So we depend on those programs that make available their services to those that cannot pay.
What would you say your biggest barrier is to helping drug endangered children or their families?
Transportation. And we don't have the services here to do that. And so to get some of those services that parents need, or for visitation, we don't have a lot of foster homes in Stewart County. So a lot of our parents have to go off someplace for treatment or for therapy or to do visitation, and a lot of them don't have licenses, and we don't have public transportation, taxis, or any of that to get our parents to where they need to go to get that proper help.
I would second that. If you go into a community and you look around, you can kind of tell the values that the citizens of that community place on certain programs. For instance, if you drove around Dover, you would see 2 or 3 health clinics that focused on physical ailments. You don't see any rehabilitation facilities, with the possible exception of Lakeway, which is coming in the future, and we're extremely excited about that. And there are very little mental health services here. Allison Boyer was mentioned, and we make use of her, but it just seems that we as a society have not put the money into substance use treatment, rehabilitation, and mental health services. And the farther you get away from the big cities, the worse it gets.
Okay, so what, we know, I don't want it to be all, doom and gloom when it comes to drug endangered children. What are some of the success stories? Obviously without saying names, but what are some of the success stories?
There are success stories. Safe Baby Court has had several success stories. CASA, they've only been active here in Stewart County since 2021, I believe, and they've served 40 children, and none of those children have re-entered state's custody or the juvenile court system, which is, when I heard that, my jaw hit the floor. I had no idea that the recidivism rate there was 0. But we've had some successes, and one case, mom had 6 kids, and mom is legally blind and can't drive. Mom lives out in the country. Mom had an abusive husband who beat the thunder out of her several times and beat up some of the kids, threw one of the kids against a bunch of firewood that was stacked up. And then to top it all off, mom's trailer gets hit by the tornado. And so we got that case in Safe Baby Court, and she was surrounded by people that cared for her, and some of the faith-based folks here in Stewart County, the churches, came together, repaired her trailer. Mom got the rehab that she needed. She got respite from having to deal with 6 kids on a daily basis with no income, and daddy's in jail. And so that was a family in crisis, and our Safe Baby Court responded extremely well, and I'm very proud to have seen that.
She got clean. She's been clean since she got her kids back 2 years ago, I think. And she knows the signs now. She knows who to look for in her community to get help. Sometimes success isn't always a child going back to their parent. Sometimes success is a child going to somebody who cares for them and who's able to take care of them and be able to create that bond for that child.
Right. I remember another case, it was a Safe Baby Court case, but someone had taken a picture of the children when they first came into our system, and they looked almost feral. They were crouching in the dirt, barefoot, dirty, unkempt, unwashed. You could tell, matted hair, and they looked almost feral. In fact, they would communicate with each other through a series of grunts. And at the end of the case, and these children were adopted. This was a termination case or a surrender, I can't remember. And that's what Safe Baby Court does, is that it accelerates the time from the event to the final judicial result. It compresses that time. And so anyway, these kids were adopted, and now I promise you, you couldn't tell that they had been abused if you were to see them today.
Okay, so if you could relay any messages to either parents, caregivers, or children that are affected by drugs in their environment, what message would you relay, or what would you tell them, or advice would you give?
Ask for help.
Yeah.
Ask for help. And don't always just think of coming to juvenile court is to get you in trouble or that we want to take your kids away, because we're not. We're proactive and we want to help before it gets to that point. And we will do our best to try to help as much as we can. But it's very important to know who your kids are hanging out with, who yourself is hanging out with. Go through phones. Make sure you look at what the effects that your drug use has put on your child and look for those signs and learn how to ask questions. And don't be afraid to take things away.
Yeah. Second that. First of all, folks need to understand that having a drug problem is not a socioeconomic indicator of anything. I lost someone in my family to a drug overdose, so it happens to every family, or it could happen to every family. And so there should not be a stigma attached to someone that has this disorder, this substance use disorder. That's number one. Number two, Trish is completely right. Get over that obstacle, and if you think that you have a problem, more than likely you have a problem. Reach out for help. Reach out before the authorities have to intervene. Reach out for your sake and for your children's sake. Just reach out. There's nothing wrong with doing that. There is nothing wrong with asking for help.
And if you know of a kid being abused, please make a DCS referral.
Yes, or call Trish.
Or call me.
Or call Trish. Or call Trish. Any last remarks?
We are very excited about the new facility coming here that is going to serve, I think, a dozen or maybe 15 ladies. An underserved segment of our population, though it be half of our population. So we are very excited about that and hope that program flourishes, and hope that at some point, one day, there will be no need for it.
Good morning. I am privileged to announce the Proclamation for Drug Endangered Children Awareness Day in partnership with the Stewart County Prevention Coalition. Whereas April the 24th, 2024 is declared National Drug Endangered Children Awareness Day, and whereas the month of April is Child Abuse Prevention Month. And whereas drug endangered children are at risk of abuse and neglect due to their parents or caregivers' illegal drug use, possession, manufacturing, cultivation, or distribution. And whereas children whose caretakers' substance misuse interferes with his or her ability to parent and provide a safe and nurturing environment and also be at risk. And whereas through multidisciplinary collaborations and community support, we increase the likelihood of intervention occurring in the lives of these children. And whereas, with intervention, drug endangered children can move from risk to resiliency. Whereas resilience can break generational cycles of drug and child abuse and can change the trajectory of children's lives. And whereas all citizens in Tennessee can play a role in reducing risk and building resiliency. Now, therefore, I, Robert Beecham, do hereby proclaim April 24, 2024 as Drug Endangered Children Awareness Day. Thank you.